Hello, welcome back. The topic today we are going to discuss is about anemia in school-going children or anemia in children. Most of the people think when we have a common idea that anemia means it happens only in women, especially during pregnancy. No, anemia can affect even children, especially school-going children. Uh, the importance of this video is to highlight why the anemia in school children is very important and what is the importance of important role of the parents, teacher as well as the child in anemia, in prevention of anemia in school children. The data shows up to 50 to 60% of the school going children are anemic, especially in the village children. They are more prone, not only village children but even in city children, even the private school children, up to 50% of the children are anemic. Of course, girl child is more prone because of their natural monthly periods. But not only that, nowadays the school young girls are attaining menarche in a very early stage. Those days it was around 12 to 13 years was a very common age where they start their periods. So there is a blood loss. But now, 8-year-old, 9-year-old girl children are all getting their periods very early. So their blood loss starts in an early age. So they are more prone for anemia. And vegetarian people, the vitamin B12 level is very low. So they are also prone for vitamin B12 deficiency anemia. And not only that, it can start even from a very young age, especially the breastfeeding. Most of the breastfeeding is the best and it should be. But those children depend only on breastfeeding for prolonged period. After years, they depend only on breastfeeding. In the breast milk, the iron and vitamin B12 folic acid levels are very low for that particular age of the child. So they are prone for anemia. So that is why pediatricians always encourage breastfeeding. Along with that, some solid food. From 4 to 6 months, they encourage them to eat solid food also. So this is very important. And apart from that, worms. Children are more prone for worms. And these worms, they suck the blood. So children can become anemic. Not only that, anemia, where there is blood destruction, so they can get anemia. And some children, because of their childhood congenital problems, they may have a sickle cell anemia. They may have other anemias because of G6PD deficiency or thalassemia. These are all right from childhood. There is a anemia causes which needs entirely different treatment. Okay, the anemia definitely is a very important thing because it's a public health problem. As I earlier told you, the country has to spend a lot of money on that. And so how to prevent anemia in school children? First, it starts with parents. So the parents should know, how to look for anemia in children. So the children will have, they may feel tired, they'll be exhausted, easily they get exhausted, they may feel sleepy all the time, they'll be irritated, there will be some kind of mood change, irritable mood, or some behavior changes can happen, and they will have a kind of palpitation, they look pale. All these things are the parents should have look into that, and they should take the child to the doctor and they should examine, and they usually once the doctor examines the child, they will do bacteria test, but the minimum is complete blood count, CBC and peripheral smear, which can show what could be the reason for the anemia, whether it's nutritional or disease or congenital or infective, so that we can come to a conclusion with this simple test. Once we know that, then we can treat easily. Okay, once the parents' part is over, the children goes to the school. in a school, parents they can look only one or two child, but in a school, in a classroom, at least 50 children will be there. Easy for the a teacher, they can spend monthly once to look for signs of anemia in children, and also they know the performance of the class teacher, they know the performance of the child, so they can easily pinpoint, they can call their parents and tell, we will do this, so they can guide. So teachers also play a major role. And the third one is the child itself. Especially I always say female children should be taught about the signs and symptoms of anemia, because they are the one who have a natural monthly periods, and they are prone for, even during pregnancy, they should look for signs and symptoms. So what is that the children should be told? First and foremost is, they should look for, when they pass motion, instead of spending time with cell phone, all these things, they should look the color of the motion. Is that black color, or there is any blood in that, and also is there any worms or any altered thing in the motion. So if there is anything, they should inform their parents. The parents can take the child to the doctor. So first it starts with early morning, when they pass motion, they should look for that one. Second, they themselves should be know how they look, whether they become pale, or they're tired, hair fall, or any their studies, they're failing in studies. All these things they should also know to look for. And if they have anything, they should tell the parents or even the teacher. Then the next, then the doctor comes and they treat. So the idea of this video is to teach the parents, teacher, and of course the child itself the signs and symptoms of anemia, how to prevent, how to look for anemia, because it's a public health problem, and it's a preventable problem. And if you don't treat, or if you don't detect at the right time, the development of the child, both physical and mental, or even the brain development, can be permanently affected. So parents, teachers, and of course the child themselves should be taught about signs and symptoms of anemia, and how to prevent that, what to look for, and whom to seek for the help. Thank you.